This is our special interview for Monday morning. Well, just last week, President Yoon Suk-yeol announced that Korea would be exiting the state of national emergency in terms of COVID-19 status as an emergency level 1 and downgrade that, which means that people here in South Korea would be able to get back to more of a normal life. And this is probably the moment that many of us have been waiting for the past 3+ years. But are we completely out of the woods? And what are some of the remaining concerns for us as we try to stay safe and healthy? Well, we have invited back to the airwaves Dr. Alicetan. She's an internist from Seoul Ms. Medi Hospital. We've had her on throughout the COVID-19 pandemic. And so, of course, now we're moving into the endemic phase. Let's say hi to her. Hi, Dr. Dunn.
Good morning.
Yes. So the government has officially declared the end of the COVID-19 emergency level 1 here in Korea. So what does this mean? What's the significance?
The significance is that after close to 40 months, for the last 4 weeks, the average number of daily deaths due to COVID is below 10. It's 7. The mortality rate is 0.6%, and healthcare capacity is stable and sufficient. Therefore, the country can downgrade its alert level for COVID-19 and transition from the emergency phase to a long-term endemic phase response. So we're not at this high alert level anymore.
Yes. So what are some of the key changes in terms of the restrictions? Of course, there were some changes previously, but what are the major changes now?
Right. So the time frame for making these new changes in policy is June 1st. And the changes involve infection prevention measures, designated healthcare capacity, and financial support policies. Self-isolation after COVID diagnosis will no longer be mandatory, and the recommended period will be decreased from 7 to 5 days. The wearing of masks indoors will be mandatory only in medical facilities that are hospitals and in residential facilities housing vulnerable populations. Also, periodic asymptomatic COVID screening will no longer be mandatory in those facilities, but recommended for the staff. And visitors in those facilities, such as nursing homes, long-term care facilities, they will be allowed to share food during their visits with their loved ones. The number of hospital beds designated for COVID patients will be decreased, but the government financial subsidies for testing, vaccination, treatment, and home isolation, they will remain as they are now.
I see. Thanks for explaining the changes. So I do want to clarify, in terms of, let's say, going to pharmacies or going to these non-residential hospitals, let's say your local doctor's office, we will no longer have to wear masks. Is that correct?
That is correct, but I actually have an issue with that latter part of your question because I feel like doctors who are in the front lines in their clinics, like especially ENT doctors, family practice doctors, they will also be exposed to a lot of viruses in their medical clinics. So,
right.
And of course, when they're doing their examinations, they're having the patients open their mouths, and they're very close to their patients physically. In my opinion, it seems like it would be safer to protect our medical staff on the front lines by having patients wear masks in those environments as well. But as you said, as it stands now, there is no requirement to wear a mask in pharmacies and in medical facilities that are what we call below the hospital level, so primary care clinics in an outpatient setting.
I see. In terms of this whole, the concerns now, I know that you've always been very careful and cautious in your approach to, in dealing with COVID-19, Dr. Dunn. So what are some of your other concerns as it's been downgraded or it's going to go into effect starting June 1st?
Well, right now we have to look at the reality. So COVID infections are increasing, as well as influenza cases are also on the rise. We're having a spring peak as well. But the important thing is the number of deaths due to COVID has remained consistently low, so fewer than 0.05 per 100,000 population. That's a very low death rate. So it appears that we have developed enough of an immunity wall for now through vaccination and natural infections to protect against severe disease. And if COVID remains a disease with minimal health impact, we should be able to continue on this path of eased regulations. The caveat, of course, is the virus still remains unpredictable. It continues to mutate. And so if we do have a new variant that is more transmissible but also causes more severe disease and it evades our current status of immunity or perhaps is not able to be picked up by our current diagnostics, then, the story will change. We'll have to pivot to a higher level of alert.
I see. And, there has been some talk about this new variant of Omicron, if I'm not mistaken, dubbed XBB 1.16. Can you tell us about this one?
Right. So even though this new variant does seem to be the most transmissible subvariant of Omicron so far, the range in potential severity of symptoms does not seem to have changed. So, that's sort of the good news and the bad news mixed together. So the threat for this new subvariant is that people who are at risk for severe disease, that would include anyone who has not been vaccinated, or elderly people, people with weak immune systems, or people with high-risk chronic diseases whose immunity has now waned because it's been more than 6 months since their last dose of the COVID-19 vaccine. These people still remain at high risk of even death. So they really do need to get their winter-spring booster to make sure that their immunity levels are high so that they can stay protected against this virus, which will spread whether or not it's detected by our testing, which is now decreased, but it will spread.
What are your thoughts regarding the government's post-COVID policies? Because the WHO and other world entities, they always point to the possibility that there might be a new pandemic. There's always going to be something on the horizon in terms of some new illness or new pandemic.
Right. So as you correctly mentioned, the government and expert entities, they anticipate that there could be another surge due to COVID, due to a new variant, or, as you mentioned, another pandemic risk because of a different pathogen altogether, in which case an all-of-government approach to pandemic response will be initiated again. Of course, screening will continue to play an important role. Right. So there will be a system of sentinel case screening for COVID integrated into our current influenza screening system. This is a system that's working fairly well, and it's able to catch the trends in infectious diseases such as influenza and COVID. One deficiency in screening strategy here in Korea, however, is, in my opinion, the absence of wastewater screening. Wastewater screening is fairly new for COVID-19, but it has the benefit of being a leading indicator rather than a lagging indicator such as hospitalizations in terms of letting us know what the community levels of COVID are. And we haven't been able to get a wastewater screening system up and running in South Korea. But this is something that I would like to see happen.
I see. Well, thank you for joining us once again, Dr. Dunn, as you always do, letting us know your thoughts, your concerns, and of course your expertise on things related to COVID. Take care.
Thank you.
This was Dr. Alicetan once again, and we went over the specifics, the details of the government's policies as we go from the emergency level down to the endemic level here in Korea. Once again, it goes into effect on June 1st, so the rules don't apply until June 1st. Keep that in mind. And it is now 8:29. It's time for your traffic update. Let's see what's